Welcome to Chapter 10, Community Organizing and Community Building based on Planning, Implementing, and Evaluating Health Promotion Programs by James Mackenzie, Brad Neger, and Rosemary Thackeray. This chapter focuses on how to engage communities in solving their own health and social challenges. Instead of imposing solutions from the outside, community organizing helps people work together to identify problems, build capacity, and take action. Let's begin by defining what we mean by community. What is community organizing? A community is a group of people with shared characteristics such as geography, interests, experiences, or identity. Community organizing is the process of helping these groups identify common problems, develop strategies, and work collectively toward positive change. First is community organizing builds local leadership and trust. Second is it shifts the focus from service delivery to capacity building. Third is it creates sustainable solutions because they come from within. Organizing and building are democratic processes. They rely on participation, transparency, and respect for community voices. Background and core assumptions community organizing grew out of labor, civil rights, and social justice movements. In public health, it became essential as planners realized that many health problems are rooted in community conditions, not just individual behavior. Organizers believe first is people want to improve their communities. Second is change works best when it's grassroots and inclusive. Third is external facilitators should support, not control, the process. Fourth is long term health improvements require community empowerment. Models of community organizing. There are three classic models of community organizing from Rothman. First is planning and policy practice, uses data and top down planning to generate change. Example, using health statistics to support policy changes in local government. Second is community capacity development, builds group identity, trust, and skills. Example, forming a parent coalition to improve school food options. Third is social advocacy, empowers disadvantaged populations to fight for justice and equity. Example, tenant associations organizing to prevent displacement. Winkler and Wallerstein expanded this with a needs-based versus strengths-based typology. They mapped organizing approaches across two axes, whether they rely on consensus or conflict, whether they emphasize deficits or assets. This typology helps planners choose a model that fits the community's context and goals. The process of community organizing and building community organizing is not linear, but planners typically follow these 10 steps. Step 1, recognize the issue. It may emerge from within the community or be identified by external partners. Step 2, gain entry into the community. Work through gatekeepers, respected leaders, elders, or organizations. Approach with cultural humility, not authority. Step 3, organize the people. Build a core group with different types of members. Executive participants lead the process. Active participants regularly contribute. Occasional participants support from time to time. Supporting participants, silent partners who can mobilize if needed. Step 4, assess the community. Use both needs assessments and asset mapping. Gather data, stories, and perspectives. Step 5, set priorities and goals. Focus on issues that are winnable, deeply felt, and widely shared. Step 6, arrive at solutions and select strategies. Choose approaches that reflect both data and local wisdom. Step 7, implement the plan. Create action steps, assign responsibilities, and secure resources. Step 8, evaluate the outcomes. Use both formative and summative evaluation. Measure what changed and what didn't. Step 9, sustain the results. Support leadership development, institutional partnerships, and funding. Step 10, loop back if needed. Revisit goals or strategies based on feedback or new challenges. Key concepts and best practices effective organizing depends on trust, commitment, and adaptability. Let's highlight some important principles. First is gatekeepers are essential, but they don't represent the entire community. Seek broad input from many voices. Second is volunteer recruitment is key, but burnout is real. Respect people's time and offer support. Third is coalitions and task forces bring together diverse groups. They promote resource sharing, accountability, and visibility. Box 10.5 outlines features of successful coalitions. Clear vision and mission, active participation. shared leadership, strong communication, adequate staffing and funding, ongoing training and reflection. Fourth is manage turf struggles and power dynamics early. Define roles clearly and resolve conflicts constructively. Mapping community capacity asset mapping flips the script. Instead of asking, "What's wrong here?" it asks, "What strengths already exist?" According to Figure 10.4, assets fall into three categories. First is primary building blocks, located in the community, controlled by the community. Examples: local residents, faith groups, neighborhood associations. Second is secondary building blocks, still local but controlled by outsiders. Examples: schools, hospitals, local businesses. Third is potential building blocks, external resources or systems. Examples: government agencies, universities, foundations. A complete map of community capacity includes all three types. This helps identify partners, resources, and leverage points. Final steps and summary. Let's wrap up the organizing process. You've worked with the community to identify issues, plan solutions, and implement change. But how do you keep it going? First is sustainability matters. Train leaders, secure resources, institutionalize changes, celebrate wins. Second is evaluation is ongoing. Use both qualitative and quantitative tools. Ask, what worked? What could be improved? Who benefited and who didn't? Third is looping back is okay. The process isn't always neat. Stay flexible. Stay accountable. Stay community driven. To wrap up chapter 10, first is community organizing builds collective power to address shared challenges. Second is it relies on participation, trust, and insider leadership. Third is choose your model based on the situation, planning, capacity building, or advocacy. Fourth is follow the 10-step process from issue recognition to sustainability. Fifth is map community assets to identify strengths and partners. Sixth is evaluate your outcomes and adapt as needed. Community change is possible when it starts with the community. Thank you for watching this video. This concludes Chapter 10, Community Organizing and Community Building, based on planning, implementing, and evaluating health promotion programs by James Mackenzie, Brad Niger, and Rosemary Thackeray. Stay tuned for Chapter 11,